Incontinence is very common after having a baby, especially one that was 4,300 kilograms, which is close to 10 pounds. This is a model of a woman's pelvis, and when the baby goes through this muscular pelvic floor, it's going to cause prolapse of the organs, especially a large baby. So this shows a woman's body. This is the front and this is the back. And this is the bladder and this is the urethra. So when a baby comes through the vagina, it results in prolapse, which is how the organs drop, like the rectum can drop, the bladder can drop, the uterus can drop. When the bladder drops and the urethra, which connects the bladder to the outside world, drops, what happens is when you cough, sneeze, jump, there's pressure on your bladder and there's decreased pressure on the urethra. So it's a gradient. Increased pressure, decreased pressure, and that causes the leakage. This little white thing over here represents something called a sling. It goes under your urethra and it holds your urethra in. It's just a hammock. I've done thousands of these. If you look online, you'll see a lot of trial attorneys. People say, oh my gosh, mesh, it's dangerous. It's something that can cause problems. What happened was 15 years ago, they came out with these pelvic floor repair kits, these big pieces of mesh inside women's bodies, size of my hand. And these pelvic floor repair kits were causing some problems. There were some class action lawsuits, and the trial attorneys were saying, hey, did you have a sling placed? Did you have pelvic mesh put in your body? Oh my God, it's so dangerous. Call us. We're going to help sue. Mesh manufacturers actually took the repair kits off, but the slings, according to the FDA, are gold standard treatment. If you see a urogynecologist surgeon, they can talk to you about whether or not you're a candidate for a sling. For a woman that's had her first baby, I might not say have a sling. It would depend on where your childbearing is, and it would depend on what a bladder study or urodynamics shows. And the other thing is, if you had a 10-pound baby, there's probably other prolapse. It could prolapse your rectum. There could be damage to your vagina. I'll see damage to the vagina where it affects sexuality, affects sexual sensation. Sometimes women have to touch their perineum to have bowel movements. Sometimes periods get worse. There's a sense of pelvic heaviness, things falling out. Unfortunately, part of the sacrifice of women having a baby is that there are things that occur that make you feel like I wasn't expecting that. Anyway, good luck with this. There's definitely solutions, and I've fixed thousands of people. Thanks.